988 will become the new national suicide hotline in less than 2 weeks.
That new number actually starts July 16th, but right here in South Carolina, there are some barriers with that rollout. WMBF News investigative anchor Ashley Bowles joins us in the studio now.
Yeah, that's right. So Ashley, can you explain exactly what are some of those barriers?
Yeah, Rachel, there are several. South Carolina, for one, has only one call center for people experiencing any kind of mental health crisis. That center expects to be much busier 9 days from now. More than 100 people from all over South Carolina dial a number on any given day that connects them to a call center in Greenville County. The calls are from people dealing with a mental health crisis, having suicidal thoughts, or just people needing someone to talk to.
What we know for sure is that listening matters. We all have enough people in our life telling us what to do, how we should fix things. But our tool really is listening and empowering people to make the choices and decisions they can without judgment.
But what happens when there's more calls than people to answer them? Jennifer Piver is the executive director for Mental Health America of Greenville County. She says right now there are 52 workstations with phones between her office and a satellite office in Greer. Only 3 to 6 people cover those phones each day.
At the highest, yes. Yeah, 6, probably 6. Every now and then we have 8 for training and things like that, but yeah.
With the National Suicide Hotline changing to 988, Mental Health America expects the number of calls to rise, reaching 4 to 8 times the number of calls each day into call centers across the country.
And it's just easier to remember. If I broke my femur, which is the largest bone in the body, and you said, Dennis, give me directions to your house. It's a simple task, but I probably couldn't do it if I was in that much pain. The same holds true for someone in a mental health crisis. It sounds simple, but they probably can't do it.
Dennis Gillen recognized a need for more mental health awareness in South Carolina. That's why in 2020, he created Half a Sorrow Foundation. He travels to speak across the state with 2 big reasons in mind.
I got 2 brothers to talk about, my brother Mark and my brother Matthew. So this is an issue near and dear to my heart. But the number is 0. I don't care what your skin color is, what your religion is, what your demographic. 0 would be a great number, and we could dream.
But Matthew and Mark show 0 isn't the reality. In 2019, Horry County saw 51 suicides. In 2020, DHEC data reveals that number rose to 64. And specifically in Horry County, we learned men die by suicide 5 times more often than women.
There are 2 types of people in the world. Those who've had thoughts of suicide and liars.
Pastor Greg Van Dyke of St. Peter's Lutheran Church in Pawleys Island heard that for the first time in a psychology class he took in college. It stuck with him ever since.
Suicide, like addiction, we like to kind of keep at arm's length and feel like it could never happen to me, my family, those that I love or care about.
While Pastor Van Dyke is not clinically trained, he's woven suicide prevention into his congregation. He thinks the new hotline number is needed, but also knows the Grand Strand needs more resources.
It's not just any particular demographic, it's that whole ocean of human beings, that whole ocean of humanity. And if we can just all be lifeguards, then I think we can save lives.
A guard of life. It's what less than half a dozen people do every day in Greenville, answering calls for the upstate, Midlands, Low Country, Grand Strand, and PD. But is it enough?
I am hoping to see that we have sustainable funding going forward, that we can spend all of our time doing the best we can for every caller, chatter, and texter with well-trained staff and enough staff to ensure that 100% of the calls are answered in state.
And this is just the beginning. Our goal in this report is to introduce you to this change and some of the people locally and across the state knowledgeable about it and mental health needs. And Rachel, obviously this is a very important topic. There's lots to it to get into. But the other thing that's important to note is that the current lifeline, it's a 1-800 number you see on our screen now, 1-800-273-8255. That's not going away.
Yeah, important information that really needs to be shared with everyone.
Yeah, and the important thing too is obviously that number's not changing, but now there's another opportunity to be able to access that very important help. So thank you so much. Again, that was Ashley Bowles with that report. Very important, very needed, especially right now.
Yeah, absolutely.
Also